So today's topic is anemia. Those who are joining late, please help them out with the topic name. It's not from the textbook, just some basics about what is anemia, different types of anemia, treatment modalities available for anemia, nutritional aspects we have discussed it in yesterday's class. So anemia, what is anemia? Anemia happens when you don't have enough red blood cells or red blood cells do not work as they should work. Okay. So that's what anemia happens. The oxygen power, the red blood cells are the ones that carry oxygen throughout your body with the help of hemoglobin. Red blood cells have hemoglobin, and hemoglobin is an element that allows the oxygen to get attached to the RBCs so that it can be transferred to and it can be transported throughout your body. Okay. Oxygen powers your cells and that gives you energy. And without healthy red blood cells that can't do their job, you don't have the energy that requires to function properly. Okay, that's why with anemia, people become very lethargic. They get tired. They lose their concentration. They lose their focus. Okay, their performance drops. That's because of lack of oxygenation in vital tissues. While some types of anemia are short term and mild, others can last for a lifetime. Some untreated ones or the genetic ones, okay? And if it is untreated, anemia can be life threatening as well. So, anemia affects different people in different ways. In newborns, some newborn babies are born with low RBC count. Okay, usually when their mothers were anemic during pregnancy, this is what happens. Newborns are born with low RBC count. Most of the newborns don't need medical treatment for anemia, but some with severe anemia, they may need blood transfusions as well. Okay. Infants, they may get less iron than what they have required when they start eating. And when you start weaning them, giving them solid food after 6 months of age, and if that food does not have iron, okay, that leads to anemia in infants because iron in solid food isn't absorbed easily as the iron is that is present. Iron in breast milk is very negligible. Okay, very negligible, but it is present, and even in some formula feeds, iron is present. So infants with anemia may appear lethargic. Children do a lot of growing between birth and the age to toddler toddlerhood. Okay, so children who are going through growth spurts, they need more iron, and children with anemia can also develop problems like delayed development of motor skills, delayed language skills. Okay, delayed cognitive skills. This can happen, and issues with learning also can happen in early childhood if the child is anemic. Women who are pregnant, women who may develop iron deficiency anemia may increase the chance of complications like premature birth, giving birth to babies who are low birth weight, stillbirths. Okay, other complications of pregnancies can also be shown if during pregnancy if a woman is anemic. So, and in women who are like designated female at birth, that is who identify as women, okay, uh, during heavy menstrual bleeding and during periods, okay, and any conditions like uterine fibroids, they may lose blood, and they can develop anemia. Okay, so that's what happens in growing stage. Okay, even in teenage, heavy menstrual bleeding can lead to anemia. Whose age is 65 or older, people who are more likely to have iron, which is poor iron diet. Okay, there are some certain chronic diseases if they have that also increases their risk of developing anemia. And with your age, the way how iron is absorbed. First of all, absorbing iron is bit tricky for your body. Okay, iron requires a lot of conditions in which it can get absorbed. Specifically, if the iron is from a plant-based diet, okay? Iron from non-vegetarian diet is bit more easier to absorb. But if the iron is coming from a plant-based diet, it's very tricky. A lot of conditions has to be satisfied for the iron to be absorbed. Okay, and whatever iron-rich food you are having, always remember that hardly 3 or 5% of the iron in that particular plate of food that you're consuming is going to get absorbed. Okay. So with age, we all know your absorption in the intestine decreases. So definitely the iron absorption will also become very difficult when you grow old. So you have to use supplements by this age. They may have confusion, depression because of anemia, heart conditions, weaknesses. People who have chronic conditions like any autoimmune disease or cancer, they can also increase the risk of anemia, specifically when the cancer uh, tumors are bleeding. Okay, cancer cells are tissues are bleeding. That could also lead to anemia. So anemia is very common. It affects almost 1/3 of the global population. In yesterday's class, we have discussed that 60% of Indian population is already anemic. Okay. And a major cause of anemia in India is iron deficiency and folic acid deficiency. You can see here, male population, they are less affected. Okay, only 4%, 4.7, hardly 5% of men can be anemic, could be anemic, but female population, 67% of female population is anemic. Okay, and largely this result because majority of this female population is in the female reproductive age group and they are menstruating. Okay, so that is one of the reason why so many females are anemic. So types of anemia, we can categorize anemia. There are n number of types of anemia, but broadly, if you want to categorize them, there are nutritional anemias. Yesterday's class, we have discussed nutritional anemia, okay? Then we have inherited anemia. Anemia is caused by abnormal red blood cells, okay? These are the three broad categorization of anemia. Nutritional anemia, we have discussed yesterday. So nutritional anemia, pernicious anemia is one of the cause when vitamin B12 deficiency is there. Okay, the B12 deficiency anemia is called pernicious anemia. So also it's an autoimmune condition that prevents your body from absorbing vitamin B12. Okay, so something happens in your because in your your immunity will go and attack the cells present in the stomach. Okay, which are the parietal cells all present in your stomach, which are supposed to produce hydrochloric acid. Okay, and when this cells get attacked, okay, attacked by your own immune system, the production of hydrochloric acid will decrease. Okay, and if the hydrochloric acid decreases, the way how vitamin B12 is going to be absorbed, that also decreases. So that's how it leads to pernicious anemia because of an autoimmune condition in which your own body is attacking your own body cells, stomach cells specifically, parietal cells of the stomach lining. Okay, that is supposed to produce your hydrochloric acid. Okay. Then iron deficiency anemia, as its name implies, iron deficiency happens when your body does not have enough iron to make hemoglobin. And hemoglobin is a substance in your RBC that helps to carry oxygen throughout the body. So symptoms are you will have extreme weakness, fatigue, tiredness, okay? Irregular heartbeats, shortness of breath, even if you do small physical activities, okay? Climbing a flight of stairs will also lead you to shortness of breath, pale skin, chest pain, headache, soreness of tongue, cold hands and feet. Megaloblastic anemia, again a vitamin deficiency anemia because of B12 or folate. Okay, when you don't get enough amount of vitamin B complexes, specifically B12 you get only from non-vegetarian diet. Okay, and or milk as well. Okay, and vitamin B B9 folate deficiency. These two could lead to megaloblastic anemia. You can see here the size of the RBC in comparison to a WBC. Okay. This neutrophil is a type of white blood cell. So this fermented foods have vitamin B12, but not in enough quantity how your body would require it. Okay. Or you have to consume some specific algae and all. Okay, some dried algae are available. They also have vitamin B12, but the way how your body requires it, the dosage and all, how the body requires it, usually fermented food may fail to give you that particular dosages. Okay, you can't have that large quantity of fermented food. So normal blood cell is of this particular size in comparison to a neutrophil, and a megaloblastic anemia, you can see here how big the red blood cell gets. Coming to inherited anemias, which you get from because of genetic predisposition. Okay. Sickle cell anemia. So it changes the shape of your RBC. Okay. You can see here RBCs are round and flexible disc. Okay. And because the flexibility that RBC has, it can easily pass through small capillaries. Okay. It can bend and pass through small capillaries, and it can supply oxygen wherever required. But when it has this sickle shape, okay, you can see here, it's like a crescent moon sickle kind of a shape. Okay. So what happens here is this kind of RBCs, they get stuck in your capillaries. Okay, they are not able to it is not as flexible as well, and also the shape does not allow it to easily pass through all the passages of your capillaries. They may get stuck in some of the capillaries, and they can get accumulated there. It leads to pain. Okay, and it leads to blood clots within the blood vessels, so other complications will follow. You can imagine if RBC is not able to pass through your blood vessels, it is getting stuck somewhere. Okay, it would lead to other complications like blood clots, pain in that area. Okay, discoloration. Then we have Fanconi anemia. It's a very rare blood disorder in which you can see here. Uh, Again, it's a macrocytic kind of case in on the left side, and at the right side you can see a person who has Fanconi anemia. Okay, they have a short stature. Okay, they have low set ears, high chance of deafness. Okay, strabismus is a clinical condition. It's very common in Fanconi anemia, in which your both the eyes don't, it's like squint eyes. Okay, uh, both the eyes are not lining up in the same direction. We usually say it as squint eyes. Okay, skin hypopigmentation, renal abnormalities, bone marrow transplantation is the treatment required here in Fanconi anemia. Then you have diamond black fan anemia. Again, it's a very rare congenital condition, inborn disorder, mostly occurs in young children. Very rare, okay, just like Fanconi anemia, it's very rare. Here, bone marrow fails to produce enough RBCs, causing shortage of red blood cells, which is what we call as anemia. And symptoms are uh, in this diamond anemia. Here, you will have the shoulder blades behind of the back bones. Okay, shoulder blades that are protruding outwards, sharp and protruding outwards. Congenital heart failure. By birth, the child will have heart failure, that is congenital heart failure, maybe because septal defect or some congenital defects that lead to heart failure. Abnormal shortening of neck. They would have a long neck, short stature. Heart murmurs may be present. Okay, abnormal or absent thumbs, snub nose, round snub nose. Okay, droopy eyelids, low set ears, small head. Strabismus is found here as well. Squint eyes. Okay, wide separated eyes, protruding upper lips. Okay, these are the signs and symptoms of diamond anemia. Then the third category, anemia is caused by abnormal red blood cells. Hemolytic anemia. In this anemia, your RBCs break down or die faster than usual. So there could be some enzymes which is doing this, okay? And sometimes your own autoimmune system, your own immunity goes and breaks down the RBC. That is hemolytic anemia. So if the RBCs are destroyed, hemoglobin will be released. They will not be capable to carry oxygen. Then we have aplastic anemia. When your stem cells in the bone marrow don't make enough RBC, you can see whatever RBC they are making, it is normal, shaped and size. It is functional, but the count of it is very less as compared to how normally a bone marrow should produce RBC. Then you have autoimmune hemolytic anemia. Your immune system attacks your RBCs. Same hemolytic anemia, but it is autoimmune. Some hemolytic anemia can come in two ways. One is enzymatic as well. Some enzymes in your body could be hyperactive and destroy your RBCs. Some viral infection, some bacterial infection can also lead to hemolytic anemia. They can destroy the RBC. And the other form is autoimmune. Your own immunity is destroying your RBCs. Then we have sideroblastic anemia. Here you can see the one RBC. It has a capability to take specific gram, at least 4 or 3 microgram of ferrous iron, something like that is the normal range what your RBC can carry. Okay, what the hemoglobin will have. In sideroblastic anemia, lot many ferrous ions are attached to your RBC, and this RBC is immature. First of all, the RBC is immature and it has a lot of iron molecules than usual. Okay, so it is not functional at all. So that is what is called sideroblastic anemia, and it is immature and dysfunctional, even though it has a lot of ferrous ions in them, but it is not functional. It will not carry oxygen. Then macrocytic anemia happens when your bone marrow is making unusually large blood cells. Okay, they are structurally abnormal, immature, and they are produced by the bone marrow in large quantities, in large structure as well. Then microcytic, just the opposite. When your red blood cells don't have enough hemoglobin, so they are smaller than usual. That is microcytic. Then normocytic normochromic anemia. The size of the RBC is normal. The size of the color of the RBC is also normal, but it happens because either you are deficient, okay, you have chronic inflammation, your bone marrow is dysfunctional, okay, so or you are bleeding a lot, you underwent a traumatic accident or internal bleeding and you lost a lot of blood, so that leads to normocytic normochromic anemia. Here the cells, RBC cells, are completely normal, but they are very less in count. Now, what are the symptoms of anemia? Fatigue, feeling too tired to manage your activities is the most noticeable symptom. Shortness of breath, that is dyspnea, can't breathe properly. You can't catch your breath even if you do small exercises. If you do cardio exercises, it is very evident because of shortness of breath. Dizziness, feeling light-headedness or unsteady on your feet. Especially you will see this among teenage girls. They sit for a long time, and if they get up immediately, okay, they feel that head rush, that kind of dizziness. Fast or irregular heartbeat, arrhythmia, cardiac arrhythmias. It feels like your heart is racing, skipping beats, heart palpitation, because what's happening is there is not enough RBC to provide oxygenation to your body. So what the heart does is it will increase the cardiac output. It will try to push more and more blood into the system so that oxygenation is available for all the tissues. Okay, the heart thinks that if we push more blood, if we pump more blood, okay, wherever oxygenation is not reaching properly, that areas will be oxygenated soon. Okay, pounding or whooshing sound in your ear. Okay, tinnitus. Sometimes you will hear this sound when you are sitting quietly. There is no pin drop silent, but there is a sound that is coming. It's like a whistle, a sound that is happening in your ear, and it's only that you can hear it. You know that is called tinnitus. Okay, so it can come and go. Okay, or sometimes it can continue for long hours as well. Headache, iron deficiency anemia can cause low hemoglobin, could cause headaches, migraines as well. Pale or yellow skin, your skin may look paler than usual. And also when you see your conjunctiva, like when you see your lower eyelids, okay, that should always be red in color, bright red in color. But if it appears pink or beige in color, it means you're anemic. Chest pain, okay, something that is squeezing your chest, pressing your chest, because lungs are also trying to expand and take in as much as oxygen as possible in response to the lack of oxygenation in the tissues because of less RBC. Your heart is pounding, it is palpitating, okay. So with combined symptoms of this, you may feel chest pain. Causes: anemia can be caused by blood loss, caused by decreased or faulty red blood cells production, destruction of RBC. Okay, these are the three main causes of anemia. No, they will not have all these symptoms. It depends on which stage of anemia you are in: mild, moderate, severe. So, anemia caused by blood loss, any gastrointestinal conditions like ulcers in your stomach, peptic ulcer, hemorrhoids, that is piles, okay, gastritis, inflammation of your stomach, and cancer. Okay, sometimes you have bleeding cancer. Cancerous tissues can also bleed internally. So that could also lead to blood loss, can cause anemia. Non-steroidal anti-inflammatory drugs, that is NSAIDs, it is used like aspirin and all, ibuprofen, aspirin. It can cause ulcer and gastritis. Okay, people who have ecosprin prescribed, those who have blood thinners prescribed, okay, that is also NSAIDs. Long-term use of this non-steroidal anti-inflammatory drugs could also cause anemia. Heavy menstruation, and if a woman is suffering from uterine fibroids, that could also lead to heavy menstruation. Post-trauma or post-surgery. Okay, even if you have undergone a surgery and in which a lot of blood was lost, okay, that would also lead to anemia. Or any traumatic injury, road traffic accidents, or any traumatic injury, stabbing wound, bullet wound, okay, in which blood was lost. So that leads to anemia. Blood loss during delivery, labor pain, and also after delivery during postpartum period, some mothers may suffer heavy bleeding. Okay, So that could also lead to anemia. Anemia caused by decreased or faulty red blood cells, bone marrow or cells, stem cell problem, leukemia. Okay. Thalassemia is a genetic condition, but it's not included here, I guess. That is also thalassemia is inherited, and again in which hemoglobin production is reduced in thalassemia. Then iron deficiency anemia, body does not have enough iron. Blood will lack healthy blood cells, okay, that carry oxygen. Sickle cell anemia, RBCs are usually round, but if they become crescent shape or moon shaped, it can get stuck in your tiny blood vessels. It can cause pain, blood clots. B12 deficiency, folate deficiency, that could also lead to blood cells that are too large in size and that immature, they can't work properly. Bone marrow and stem cell problems like aplastic anemia, but your cells are producing healthy RBC, but not in enough number. Quality is there, but quantity is not there. And usually it can like because of any genes that has been transferred to you by your parents, or because any bone, if the bone marrow was injured because of any medication, radiation, any chemotherapy, okay, in which bone marrow was also in the way of this radiation and chemotherapy, it could lead to leukemia or aplastic anemia. People who suffer from leukemia, that is blood cancer. Then lead poisoning. Lead is toxic to bone marrow, and if you have lead poisoning, bone marrow functions will be suppressed, leading to less RBC production. Thalassemia, again a problem with, it's not a problem with RBC, but it is a problem of hemoglobin formation. Okay. Body makes really small RBCs, though it can make enough of the RBCs, and it sometimes it can be asymptomatic, it can be sometimes severe as well, and it is passed through genes. Those who suffer from thalassemia, they can go to blood banks. They can get their blood transfusion done throughout the day. Okay, daycare blood banks function for thalassemia patients. But here the RBC, we can't classify thalassemia completely as anemia because RBC production is fine. The quantity is there in RBC, but the quality is less. Okay, like hemoglobin formation is not appropriate in thalassemia, but the RBC production is appropriate. Iron deficiency anemia causes diet which does not have enough iron, especially in infancy, children, teens, vegans, and vegetarians. They are at higher risk of iron deficiency. Certain drugs, food, and caffeinated drugs, overconsumption of these food items. Digestive conditions like Crohn's disease, or if you had a part of your stomach or intestine removed, okay, any bariatric surgery, gastrectomy or jejunectomy, ileostomy. These are different types of surgeries in which a part of your intestine could be removed because either it is infected, inflamed, it could be cancerous as well. Okay, a part of the digestive system is removed. So that could also lead to iron deficiency anemia. Donating blood too often. At least you should have 3 to 4 months of gap between two donations. Endurance training. Too much of endurance training means resistance training. Okay, like weightlifting, cardios, heavy cardios, weight bearing exercises. Okay, they come under endurance training. Too much of endurance training without proper concentration in diet, that leads to anemia, because in endurance training, your body uses up a lot of energy. Okay, your body uses up a lot of energy, and sometimes the normal production of RPCs are not able to compensate the energy lost. Okay, that leads to anemia. Then pregnancy and breastfeeding. In these two physiological condition of a woman's body, naturally the body will use up a lot of iron in your body, because it takes a lot of energy within a woman's body to maintain a pregnancy and to maintain lactation. Okay, periods. Okay, for women, or your periods, that also could lead you to iron deficiency anemia, heavy bleeding. Common cause is chronic slow blood, usually from your digestive system. If you have any worm infestation, parasite infestation, okay, slowly your gut is bleeding, okay, on a daily basis. Some amount of blood is lost from your gut, that leads to anemia. One second. Am I audible now? So anemia linked to other chronic conditions. If you are suffering from any long standing inflammation, okay, from a pretty long time, if any chronic inflammatory diseases you're undergoing, like arthritis and all, okay, that could also lead to anemia, because the inflammatory proteins that are produced in your body since a long time, that can slow down your bone marrow's production of young RBC. Okay, so obesity, advanced kidney diseases, hypothyroidism, getting old age, cancer, infection, lupus, diabetes, rheumatoid arthritis. Okay, people who suffer from these conditions, there are high chances that their bone marrow will get suppressed over the period of time, because of the inflammatory proteins produced throughout these different stages of diseases, that can suppress the bone marrow. Okay, and anemia can be formed. Anemia caused by the destruction of blood cells. When blood cells are fragile, they can't handle the stress of traveling through your body. So they must burst. And that is what we call as hemolytic anemia. So first of all, there are various causes of hemolytic anemia. Your blood cells are bursting on its own. Okay. Lysis is taking place, breakdown is taking place. So first cause could be the attack from your own immune system. Okay. Lupus is a condition very rare in India. Okay. But it's in Western countries. Also, it is rare. It's genetic as well. Okay. Lupus, it can happen to anyone, even a baby who is still in the womb or a newborn. Okay, they can also get lupus, and it is called the hemolytic disease of the newborn. Condition can be passed through your genes, such as sickle cell anemia, thalassemia, and thrombotic thrombocytopenic purpura. Okay, TTP we call it. So in these conditions also, hemolysis take place. If you have enlarged spleen, okay, in rare cases, this enlarged spleen can trap healthy blood cells and destroy them too early. Because when the RBCs get old, okay, a usual lifespan of your RBC is roughly about 120 days. Okay. So when the RBCs are getting older and older, they go to the spleen to get destroyed there. Spleen will keep all the scavenged iron molecules for future use, and the remaining will be excreted out of your body. Okay. So if you have splenomegaly is what we call as enlarged spleen. Okay. In this case, it can trap RBCs which are not that old and yes, destroy them too soon. Okay. Anything that puts a strain on your body, such as infections, recurrent infections, drug, snake bite, spider bite, any venomous bites, okay? Certain foods that are inflammatory in nature, okay? Toxic in nature, certain foods that have toxins that could also cause hemolysis. Toxins from advanced liver or kidney diseases. Because in advanced liver or kidney diseases, your body is not able to filter out the toxins, okay? So when the liver and kidney is healthy, you don't require any detoxifying drinks like what they market. Okay, cucumber water, lemon water, all this like different, you check YouTube channel for a detoxifying drink, you get so many options on it. Okay, even in some market, um it is available. Okay, get some powders, mix it in water, have it, it's a detoxifying drink. Tea, some kind of teas are also sold, but you don't require it actually. Okay, if you have a healthy liver, if you have a healthy kidney, you don't require all these things, and you are eating fresh food, raw fruits and vegetables are a part of your diet, you don't require any detoxifying drinks as such. But if you are a kidney patient, if you are a liver patient, okay, your body is the detoxifying component of your body is not working properly. Okay, so that leads to toxins getting stuck in your body, and these toxins can cause hemolysis. Vascular grafts, prosthetic heart valves that are done just to correct any septal defect. Okay, children who are born with ventricular septal defect or valve defect. Okay, children who are, like we say, like the child is born with a hole in the heart. Okay, these actually, the medical terminology is ventricular septal defect, valvular defects, etc. of the heart. Okay, so some artificial prosthetics are kept in the child's heart to close that defects. Okay, tumors, severe burns. Okay, being around certain chemicals, high blood pressure, clotting disorders. Okay, these could also lead to hemolysis. So diagnosis of anemia: RBC, CBC test, complete blood count. You can do that. It will measure your blood cells, hemoglobin, and the other parts of your blood as well. Our platelet count, white blood cell count, different types of white blood cells, eosinophils, basophils, neutrophils, okay, leukocyte, okay, all these count will be checked. Doctor will also ask you about the family history, medical history after a complete blood test. Some more tests may be required, like blood smear, to see the type of cells in your blood, okay, the size, the chroma of the blood cells, to check the shape of your blood cells, okay, reticulocyte count, to check the immature blood cells in your blood. If there are too much of immature blood cells, your bone marrow is under functioning. So treatment of anemia: Aplastic anemia will need medication, blood transfusion, and or a bone marrow transplantation. Hemolytic anemia, again, medication that can hold back your immune system, specifically suppressing agents will be prescribed here that suppresses your immunity to hold your immunity down so that it does not attack its own host. Okay. If it is caused by blood loss, you might require a surgery to find and fix the bleeding, like in peptic ulcers, stomach ulcers, any tumors, any cancerous tissues that are bleeding. Surgery would be required to fix the bleeding. Iron deficiency, you have to take iron supplements and change the diet. Okay. Sickle cell anemia, painkillers are given because it causes a lot of pain to the patient because this sickle shaped RBCs are getting stuck in the capillaries. Folic acid supplements, intermittent antibiotics, oxygen therapy is given to them. B12 or folate deficiency, they are prescribed with supplements. Thalassemia usually will not require any treatment, but if it is a severe case, you will require blood transfusion. A day-to-day blood transfusion or weekly blood transfusion is required. Bone marrow transplantation, if it is available, or a surgery. So diet in anemia, to treat anemia, you have to eat iron-rich food, the foods that have most amount of iron. The best sources of iron are kept here, okay, kept on the screen. Some meat, eggs, green leafy vegetables, iron fortified foods like cereals, beans, seafood, peas, nuts and dried food, lentils, okay. Lentils have less amount of iron, but uh, you can add more into it by adding some green vegetables into the same meal. So recommendations for anemic diet: fruits rich in iron like pomegranate, watermelon, custard apples, apples, tomatoes, dates, figs. Okay, these are dry fruits. Dates, figs should be consumed daily. Nachni, rajgira atta, okay, jaggery, beetroot. They are also good source of iron. Cooking in a cast iron vessel is helpful, but only cook it them. Don't store the food in iron vessels. Okay. Moringa leaves are also rich in iron and other vitamins. Add more vitamin C in your diet. That helps in the better absorption of iron. Have citrus fruit. Work, exercise regularly. Okay. Avoid these things in the same diet. Milk and dairy product will interfere with iron absorption, so keep them separate. Okay, don't stop having milk or dairy products. You can still consume it, but when you're having an iron rich food, be conscious about it that you're not consuming any dairy product in the same meal. Okay, overcooking has to be avoided. Food that destroy the nutrition should be avoided. Overcooking, over processing. Calcium and iron rich food should not be taken together, as I mentioned. Dairy products and iron rich food should not be taken together. Tea and coffee, avoid them with meals. Gluten rich food like wheat, refined flour, maida, etc. avoid because they can trap, okay, even if you're having chapati and some green leafy vegetable, okay. Majority of the iron from the green leafy vegetable will get trapped with the gluten. Okay, even though gluten is not causing you any allergy, okay, you do not have celiac disease. You don't have the gluten is not causing you any major allergies, but still gluten is a protein that is sticky in nature and it can trap some vitamins and minerals that not allowing it to be absorbed. Okay. Alcohol, smoking, tobacco, reduce it. Avoid excess blood loss. Treat the cause. Even if you're suffering from heavy menstruation, check with the gynecologist and treat the cause. Supplements. You can take iron supplements. It will increase the amount of iron and hemoglobin in the body. Ferrous sulfate, It comes in tablet and liquid form. Okay. Consult a doctor about iron supplement for anemia and see how they are recommending you to take it, because based on your age, based on your gender, okay. If it's a pregnant woman, they will have a separate different dose. Lactating women will have different dose. Non-pregnant reproductive age women will have different dose. Children have different dose. Okay, dosage is recommended by the doctor, but typically take it on an empty stomach. Don't combine it with milk, caffeine, or calcium supplements. Okay, give it 1 hour or 2 hour gap. Okay, when you are having iron supplements in empty stomach, have it with a fruit juice, that is citrus. Okay, orange juice, lemon juice, or if you have the habit of drinking lime water, lukewarm lime water early in the morning, you can have the iron supplement with that. It will enhance the iron supplement absorption. Okay, and after 1 hour or after 2 hours, you can take the calcium supplements, tea, coffee, milk, whatever dairy product you can take. It may help to increase the iron absorption if you're taking the supplement with vitamin C, like as a glass of orange juice. Anemia and pregnancy. Body produces 30 to 30% more blood during pregnancy, and it means you need more iron, more vitamins. Okay, your cardiac output doubles by the third trimester. Whenever a woman is getting pregnant, by the last trimester of her pregnancy, just imagine if the body has 1.5 liter of blood, okay, on an average, by during the pregnancy, by the time she is 8 month or 9 month pregnant, the body has almost 3 liters of blood. So the blood volume is doubling, cardiac output is doubling. So definitely the iron and vitamin intake also has to be kept up. Okay, it has to meet up with this pace. When mild anemia is normal during pregnancy, severe anemia could put your baby at risk for anemia as well, or going into preterm labor, low birth weight babies, etc. Pregnant and anemic are also higher risk of blood loss during labor, and they may have harder time fighting infection. And during the puerperium is the time after pregnancy, the 42 days. Okay, 42 days is called puerperium, postpartum. Okay, that time is very ideal for mothers to get back on their health. Okay, they should not get any infection during that period. Majority of the maternal death can take place during that particular time of puerperium. Okay, after labor, the 42 days. Okay, so health wise, you have to be very conscious about the mother's health after labor. During pregnancy, 27 mg of iron on a daily basis should be taken. If history of gastric bypass, small bowel surgery, that is small intestine surgery, is there in the pregnant woman, if you are not able to take iron supplements, through IV, intravenous iron supplements will be given by the doctor. In the clinic, it is done. Okay, not at home. Through the IV route, okay, like how you get IV injections directly into your bloodstream. Okay, iron supplements, iron specific solution in a specific format, iron can be given through IV. Only if you have a history of gastric bypass surgery, bariatric surgery, small bowel, that is intestinal surgery, has been done, which means even if you take iron supplements, it will not be absorbed, because anatomically your GI tract is compromised, okay, to absorb iron. So it is best to give you directly the shot of iron into the blood vessels, IV route. So risk of anemia in pregnancy, neonatal risk, that is newborn risk. The child may be low birth weight, small for gestational age, which means the child is of 9 months at 9 months and 10 days, the child was delivered, but the size of the child looks very small for that age. Okay, fetal distress, preterm birth, offspring risk when the child is growing, memory loss or memory disorders, processing disorders, Okay, mental health disorders, intellectual disability, iron deficiency. In maternal risk, preterm labor, placental abruption, that is, placenta breaks down sooner than when the baby is mature enough to come out. Okay, that is placental abruption. Postpartum hemorrhage, severe postpartum hemorrhage, too much of blood loss after delivery. Preeclampsia. Preeclampsia means high blood pressure, protein in urea, swelling in the body. Okay, so together, all these things come together. We call it preeclampsia. Then hysterectomy. You may sometimes have to remove the uterus as well. Okay, in severe cases of anemia. Maternal shock because of severe blood loss. Okay, the body goes into a stage of shock. Increased ICU admission, NICU as well as SICU. Mothers will be admitted in a separate ICU. Children will be admitted in a separate ICU, that is increased ICU admission. Maternal death also. Fetal distress, the child's heart is not beating properly. The child's heartbeat, it's not proper. Okay. Fetal body is not getting enough oxygenation. It's a combination of a lot of symptoms. So that's all about anemia in detail.